Okay. So if you've read and understood, considering it's surgical anatomy station, please tell me what exactly are you looking at?
Mm, I'm looking. This is the anatomical picture showing different triangles of neck.
Right? How would you classify the triangles of the neck?
Uh, Triangles of the neck can be um, classified into anterior and posterior
Posterior?
triangle.
Yes,
And
broadly.
anterior triangle can be further.
Yes.
Sorry, ma'am.
Yes, you were telling can be divided into two broadly, and then please.
Then anterior triangle can be further divided into three sub triangles or
Four.
subgroups. That is
Four.
submental triangle
Hmm?
and muscular triangle and carotid triangle.
Yes, and there is four. What is the fourth triangle?
Submental,
Yes,
muscular and carotid
and submandibular triangle. Okay,
submandibular triangle.
right. So therefore, so what makes or what is the point where these two triangles, anterior and posterior, are divided by what is this?
Uh, by sternocleidomastoid muscles.
Please tell me the attachment of sternocleidomastoid muscle.
Mm, uh, External, there will be external head and clavicle head.
Yes.
Then it will attach into mastoid process of occipital bone.
All right. In the beginning, its origin is
In
where?
origin is mastoid process of the occipital bone, and it will insert in the sternum and clavicle.
Okay, not quite. What is the function of sternocleidomastoid muscle?
Function of sternocleidomastoid is lateral rotation of the neck.
Okay, what's the nerve supply of this muscle? All
Nerve
right,
supply.
we'll
Mm,
come back to that later.
I'll
Okay.
come back to
You
later.
were telling me about the four triangles, right? Please tell me what are all right. If you could tell me how the carotid triangle is formed.
Carotid triangle is uh, formed by superior belly of omohyoid in the inferior side, and the um posterior on the posterior side, like anterior border of sternocleidomastoid, and posterior belly, and this one side will be formed by posterior belly of digastric muscles.
What are the contents of the carotid triangle?
Contents of the carotid triangle are uh, internal carotid artery, internal carotid artery, and internal jugular vein, and
All right.
and
Okay. The posterior triangle is further divided into how many triangles and what are they called?
posterior triangle.
Yes.
I'll come back to
Okay.
you, man. I think
Doesn't
only
matter.
one thing.
Yes. All right. If you could identify the image you're looking at, which view is this?
This is the anterior view of neck.
Yes. Anterior view of the neck showing one organ. If you could identify this big organ covering the neck.
This is thyroid.
Yes. What are the parts or of the thyroid gland?
Parts of the thyroid gland are there are two lobes
Yes.
bilaterally with
Yes.
isthmus
Isthmus.
in the
Yes.
connected by
Center.
isthmus in the center.
Yes. Please tell me the blood supply, and from blood supply, I mean both arterial and venous of the thyroid gland.
Arterial supply are mainly three: superior thyroid artery, inferior thyroid artery, and superior thyroid artery uh, uh, from the external carotid artery, and um,
And inferior
middle
thyroid artery, yes,
inferior thyroid artery by the thyrocervical trunk, and
yes,
in very less patient there will be in very less population there will be thyroid inner artery, which is directly from the branch of aorta,
very good.
and
And the
venous supply
venous,
will be
yes,
from superior thyroid artery, superior thyroid vein, middle thyroid vein, which will drain into uh, internal jugular vein,
Yes.
and inferior thyroid vein, which will directly drain into subclavian vein, that will drain into brachycephalic vein.
Okay. Now, please tell me the embryology of the thyroid gland, how the formation of thyroglossal cyst takes place.
Thyroid gland develops from the posterior end of the tongue, that is called foramen cecum.
Yes.
It will descend into the neck. It will descend anteriorly and through the hyoid bone and within the pretracheal fascia.
Okay. Incomplete descent of the thyroid gland results into what complications, please?
Thyroglossal cyst.
All right. At
Complete
what level?
thyroglossal cyst.
Okay. Lingual or pyramidal thyroid, that is one. Incomplete closure of the pathway of the descent results into thyroglossal
Thyroglossal
cyst.
cyst.
Okay. All right. At what vertebral level the thyroid cartilage is formed?
Thyroid cartilage at the um, thyroid cartilage
C4, 5.
C5, C4.
All right. Okay. If you could identify, right. I think I have another image. Yes. If you could identify in this here, the blue one, what is this 11? And tell me the formation or the tributaries of this.
This is external jugular vein. It is formed by retromandibular vein and posterior auricular vein.
Okay. And where exactly the course? After formation, it goes and?
It goes to first. It goes to first part of subclavian vein. Sorry, it drains into subclavian vein.
All right, okay. If you could come here on the right hand side, there is another image. If you could identify this 11, please.
11 is external carotid artery.
Okay. What are the branches of this structure?
It has anteriorly three branches. Those are superior thyroid artery, lingual artery, facial artery. Posteriorly, it will be posterior auricular artery, occipital artery, then ascending pharyngeal artery, and its terminal branches are superficial temporal and maxillary artery.
Okay. Please tell me what muscles are these?
These are superficial strap muscles.
Yes, please
Those are
identify them. What is 54?
54 is superior belly of higher,
Yes.
and 40. Oh, yes.
And all right, here it is one. If you could identify 60, what is this?
60.
Thyroid membrane, that can be
Okay.
asked.
Right ahead. Okay.
Okay, if you could, all right. Yes, there are few other structures as well, but Bell has gone. So thank you.
Thank you, ma'am.